Hi everyone, this is Pete Delatorre. I'm the CEO of Camacol Doral, and welcome to another Camacol Talk. This program is brought to you by Career Source South Florida, the City of Doral, Baptist Health South Florida, and City Place Doral. This weekly video podcast focuses on the business leaders, the community leaders of South Florida. My guest today is Dr. Wilmer Mata. He is a general surgeon with Baptist Health South Florida. Let's chime in on that conversation. All right, as promised, here is Dr. Wilmer Mata from Baptist Health South Florida. How are you today?
Very good. Thank you very much for having me. How are you today?
I'm doing fantastic. I know you're a very, very busy person because you do a lot of everything, and that's a blessing for Baptists and the community at large here in South Florida. Dr. Mata, a little bit about yourself before we get into some of your specialty and what you do.
Yes, of course. So I'm from Venezuela. I was born and raised, and I actually did med school there. In 2010, I came to the United States, and I did research. Then I matched in surgery in Indianapolis, where I did my training for 5 years. Just before that, I did a little bit more what we call lab research as well. And then after my 5 years, I came down to Jackson South and did my fellowship for one more year for minimal invasive surgery. And then since then, this is going to be my third year in Baptist.
Third year about. How's that experience been?
Awesome. It's incredible. The hospital, the facilities, the resources, all my partners. It's been an amazing experience.
You know, what's really, for me, a very impressive thing from my perspective is the couple of things that, obviously, the expertise and all of the healthcare experts, the services that you provide. But it's also in the mindset and the philosophy of truly, truly serving the community. And that appears to be in the DNA of you and all of your colleagues. How does that make you feel to be part of an organization that is providing top of the line healthcare, but at the same time is so involved in its local communities?
It's amazing how Baptist and all the leadership really has taken the next step for healthcare and to provide the care. And now we're opening the new hospital Doral is really expanding that service to the community at Doral. And my own, it's funny, the service portion that you're mentioning, because my father is a general for the National Guard back in Venezuela, and I always, since I was very young, I always saw that drive to help the community. And when I was growing up, I wanted to do something to help others, and I went through different thoughts. And at the end, medicine was for me that it made a click in my head. And then later on, during my medicine career, I have my grandmother, which basically my second mother. She became ill, and that's why it kind of surgery started clicking in my head. Then when I came to the United States, I started doing research, and I really saw the opportunity for the future and all the technology and all the things that in the future are going to be part of our health system. And when I did research, I did a little bit of research also at Baptist, one of the Baptist facility at the main campus. And then it popped my eyes, and it's when I realized the resources, the people, and really they really look forward to keep expanding and getting the best healthcare ever.
You are, again, a general surgeon, and you work with patients at all different levels, all different needs. Tell us a little bit about the types of surgeries that you do, and how are you utilizing innovative processes in
Sure.
performing these surgeries?
The innovative process starts since you see the patient. Once you order imaging status, for example, the CT scan, the ultrasound, all our technicians or our equipment is really top notch. The visualization, the quality of the image that you get really to make a diagnosis is pristine. And then we do different levels, and we come from, the general butter, what we call in general surgeries, usually things like appendicitis, hernias, and gallbladder is probably the most common thing. We carry a platform for laparoscopic and robotics, and also endoscopy. And the a little more complex cases like colon cases or stomach cases, it's really the resources that the healthcare provides. It's amazing. And we basically, my day goes from really easy bread and butter case, a little bit more complex, and the other portion is the care itself, from when the patient is very sick, the intensive care unit care, and all the other resources with all the other specialties as well.
There are obviously all types of surgeries. There is mild cases, medium, and as you just mentioned, very intense and very, very serious. But I would say, and by knowing a lot of surgeons and you and I talking here today, there is no small surgery, is there? I mean, they're all, every one of them is so important, especially in the life of that patient. Because you could have someone that they spend their whole life and they've had a lot of surgeries, and you can meet someone that, later on in their life has their very first surgery, and it may not be that serious, but it is important to them and it's serious to them. And how do you look at all of that?
Well, it's funny that you say that, because one of my mentors from med school, he used to say, it will translate something like, the operating room is not barbecue and beer, it's fire and steel. So it's a rough sport, it used to say. Surgery is a rough sport, right? It's a contact sport. And when you talk to patients, we do have statistics, correct? And you can quote, 10% this, 3% that, 20% that. When it's you, it's 100%.
Absolutely.
And we see that, we know that. So it's different from the perspective of, also, each case is different. It's funny how gallbladder, yes, is basically the same anatomy, but at the end it's not, because people have variations. And even though that those variations enter into statistics, at the end of the day, it's 100% in that particular moment. So it's funny that you say that, because every day I remember that mentor telling me, hey, this is fire steel, it's a contact sport. It doesn't matter how easy you think it's going to be, or even how complex you think. Sometimes you think, oh, it's going to be complex, and then it's a breeze, it's piece of cake. And sometimes you think, oh, this is going to be super easy, and then you get a little bit your bumps every day.
There is no routine in surgery, correct?
There's no routine in surgery. That's correct.
It's like I said, it's important, whatever it might be. It's important to that patient, and it's their pain and their discomfort, and then the emotional part. So yeah, let me look at that. I mean, you're a surgeon, and you have a job to do to perform the surgery and take care of that medical aspect. But you also wear another hat, and that other hat is dealing with the emotional side of a patient. We're going to have surgery, and obviously, the more serious the surgery, the more the emotional impact. How do you juggle the two?
Well, I always remember one thing, and this is probably before med school. I was a patient once, and I'm a family of patient as well sometimes, and I have two little ones at home, and a wife, and a mother, and a sister. And my main goal when I talk to somebody is, number one, make sure that they understand what's going on. Number two, make sure that I can facilitate that understanding. Sometimes I always avoid the complex terms, to put it in a kindergarten level type of thing, not only because of the complexity of what we do, but also because I understand that in that moment, anxiety hits in, maybe even pain medications is in your system. So the understanding portion is super, super important. So I was keeping in mind, how can I explain this to my mother? How can I explain this to my 4-year-old? How can I explain this to that person that really understands what's going on, and how can I assure that I'm going to give my 100%, 110% to provide that care, as if those patients were my family.
How did you navigate, and this is not over yet, but how did you navigate the things that you did as a surgeon through COVID?
It's interesting. COVID, I think it changed the world, and it's changed the world forever. We're doing this in a Zoom meeting, for example, and one aspect is going to be, probably we're going to be doing more telehealth now than ever. I think we had the resources, but there was not the opportunity to really expand that care. And during COVID, I think the anxiety around the danger of the virus caught us in a moment of maybe despair and even anxiety. But I think with the resources that Baptist provided, we were floating, and we were able to move ahead and really provide the care for the community that the community needed.
A lot of surgeries were postponed. If it wasn't life-threatening and they were elective,
Right.
they were postponed. But again, I go back to what we just talked about a minute ago. Any surgery is serious.
Right.
And if someone has an issue, they have a bad knee or they have a whatever, to have that surgery postponed,
Right.
is something, another factor to deal with, correct?
And not even that, if you think about it, if you need a surgery, you know that you have a problem. But what about the people that missed their screening colonoscopy, for example, or their screening mammogram? And those people, some people out there are still afraid of coming to the hospital to do the screening, so they are postponing. Where this is going to be almost year number 3. So if they're still scared, they've been postponing the colonoscopies, for example, for 2 to 3 years. So screening colonoscopy, for example, has been proved that it can help us diagnose something early enough so that we can take care of it early, so you don't have to deal with the advanced disease. And that's one aspect. The other aspect is, for example, people, I'm having a little bit of a chest pain, but I'm not going to go to the hospital because it's packed with COVID. And those people, what happened with those people as well. So if you think about it, there's multiple layers and dimensions that they can really go into depth, and it's going to be interesting, not now, but maybe next year or the next couple of years, we probably might see all these people that missed their screening studies. So I actually encourage everybody, hey, make sure that you got your colonoscopy, your screening, mammogram, all your stuff that you need to have, and don't postpone it anymore, because it can really save a life, and can really save not just life, family, economics as well, social. It's a huge impact that we've seen in that.
As we wrap up our conversation, any final comments that you want to share with the viewers and the listeners, in the realm of the things that you do?
So, first of all, thank you very much for having the opportunity. I'm very excited, and we, branching out into the RAL, it's been an amazing experience. Our service will be there for you if you need us. We have our clinic, it's in downtown Doral, and the new hospital, which is in 9500 Northwest 58th
Street. Yep.
Just across the police. It's a beautiful facility, beautiful hospitals with brand new technology. So we're very excited to be there, and we're very excited to help and provide the service in the community.
I was honored to be there for the ribbon cutting of the hospital, and we got the tour. And what a fabulous location! I mean, this is the epitome of 21st century innovation.
Correct.
And a hospital that can continue to grow and innovate moving forward, like yourself. So, thank you very much for being with us today, and for your insights and what you do for the community and all of your patients.
Thank you very much. I appreciate it.
All right. You take care of yourself. Bye-bye now. A big thank you to Dr. Mata for sharing his expertise, his insights on a very, very, very important part of all of our lives. It's all of the surgeons that perform these surgeries and operations, and with, again, the hope of getting us better, feeling better. I want to ask all of you to follow us on all of our social media platforms. And when you get a moment, subscribe to the Camacol Doral YouTube channel. Again, thank you very much for being with us today. Again, every Friday, 11 a.m., we do this broadcast. So thank you very much. Have a fantastic weekend and take care.